So I brought a model. We can look at some of the things that we've been talking about today.
Excellent.
What do you say? These are the frontal lobes here, the temporal lobes here and here, parietal here and occipital here. And these are the, easy parts of the brain. The cerebellum we've taken away, and this is the part of called the brainstem, which directs all the information from the upper part of the brain, the cerebrum, down into the lower areas, spinal cord and cranial nerves and so on.
And I think one interesting thing when you look at it like this is the fact that you see the surface of the brain, which is certainly an important part in a lot of the brain, but there is a lot of stuff under the surface that's important to us too. And I think that's what we're going to move into now. And from an epilepsy surgery standpoint, very important to know what's going on in deeper areas as well.
Yeah. So now I've actually split the brain into two different parts here, and this really shows the corpus callosum well. So the corpus callosum is this band right here. This is what it looks like in the side view, and from the top, it's a very beautiful white shimmering surface right under a couple of arteries that you can see there. This actually gives a pretty good idea of what the corpus callosum looks like. The other structure that is very important in epilepsy is that this is the temporal lobe. I've taken the temporal lobe off of the brain here, and this little part of the temporal lobe that is shaped like a seahorse is called the hippocampus, which means seahorse. And so for certain kinds of epilepsy that really come from the temporal lobe exclusively, so-called mesial temporal sclerosis, that's really the target.
Right.
We talked about vagus nerve stimulation, and the vagus nerve is one of the cranial nerves, meaning it enters into the brainstem in some place around here. But the place the operation happens is outside of the brain entirely on the neck. That's one point. Do you want to point out where you put deep brain stimulator electrodes?
Absolutely. So we talked about them being deep, and certainly they do go to a deep part of the brain. So if you imagine an electrode coming through the brain, the target is sort of right here in the middle, something called the thalamus. And you can imagine, getting in there, you sort of really want to carefully pick how you're going to get there without injuring anything. And to make matters more complicated, you don't want to just put it in the thalamus. You need to actually put it in a very particular part of the thalamus or target in the thalamus. So that's where the very precise targeting techniques and understanding the anatomy, both like this, so that when we look at things we know what's going on, but also individualized to the patient on their imaging to really make sure you get it there safely. All these little red lines here are blood vessels that we know we need to avoid to prevent injury, but also obviously to make sure that the therapy does what it's supposed to do. If we don't get it in the right spot, it's not going to have the benefit that it otherwise could.
And one other kind of seizure that we didn't talk very much about the seizure, but we mentioned it briefly, is hypothalamic hamartomas. But now as long as you have the brain there, could you show me where the hypothalamus is?
Right, so just in front of the thalamus is the hypothalamus right here, very close by. And these hypothalamic hamartomas are very interesting. They're little kind of balls of tissue that shouldn't be there. Not like a tumor, but that formed in that area that shouldn't be there. And they're frequently a cause for seizures. And because it's such a deep target, actually we use similar techniques to things like deep brain stimulation in order to guide minimally invasively a laser probe into that area to ablate it while preserving all of these important structures around it.
This gets into the point where we can look at where the seizures are coming from on the basis of something we might see on the scan. We know right in the brain where it is coming from, and the kind of seizure goes along with where it is, and that tells you how to treat it. And it's really, it's a very interesting small story within all of seizures just on its own. Hypothalamic hamartoma.